Doctors Hospital is a private hospital in the Cayman Islands offering first-class medical service and cutting-edge technology. I am Dr. Yaron Rado. I'm the chairman of the board of Doctors Hospital and the chief radiologist. In these videos, we are going to be sharing the latest developments in healthcare that Doctors Hospital is bringing to the Cayman Islands. In this episode about the coronavirus, we are talking to Dr. Andrew Robinson, who is the chief of staff at Doctors Hospital, about what the hospital is doing and the medical intricacies of the coronavirus. Next, we're going to talk to Raoul Pal, CEO and co-founder of RealVision. We're going to discuss implications of the coronavirus to our financial health. But firstly, we will talk to Dr. John Lee, who is the Chief Medical Officer to the Cayman Islands, about what the coronavirus means for all of us.
The threat has been real for the last 6 to 8 weeks or so, and over that time the Ministry is working very hard. The top of our agenda is that we need to inform the public, and that has been our principal driver, to be releasing more and more information to the public about how we are going to manage this situation together, because it is a question of doing it together. The figures that are coming out are that a lot of people are going to be affected, and as a result, this is not something that the health community can manage on their own. It needs the public support. We are not going to be able to see everybody. A lot of people are going to have make some distance communication with their healthcare professionals, because 80% of people will be mildly affected. So that's, I guess, a piece of good news. And also, it won't be the whole population that's affected. There is a caveat there, because I know that in Cayman, mild for many people is not the same as mild for a doctor. And we all know that when doctors say mild, it means, you don't really need hospital care. But that still means people may have significant temperature at home.
Sick in bed.
Yeah, will be sick in bed, and they will not be feeling great. But that they don't need to come to hospital. They'll manage on their own, as you would do with the flu. You mentioned about the issue about touching. Yes, I'm trying to remember, and it's quite difficult. The social distancing of 3 to 6 feet, the fact that you do this, but even this is taking you closer than 3 foot. So over the last few weeks, we've been doing an awful lot of work behind the scenes. Obviously, this has initially just been a health response. We've been enormously helped by the HSA and the ministry staff, and by the private health providers to offer their support. We've met with the private health providers whenever we could in order to discuss how we can progress together as a group. This needs to be a countrywide support. The Ministry of Health and Public Health have been working flat out almost constantly on the matter. So we are now really grateful for the support that the National Emergency Operations Committee, now that's been activated, it means that we can get multi-agency support. We were getting multi-agency support before, but now it's sort of more formalized. So we can reach out to the different agencies to make sure we have coordinated plans of action. When I say coordinated plans of action, it doesn't mean that we don't have plans of action in any event, but there are some areas like, for example, if we were to need to cordon an area, exactly how is that going to take place, and exactly how are we going to look after the cordon, what are people's access going to be to supplies and to care and that sort of thing. Those details of some aspects need to be threshed out. In other areas like the hospital's emergency responses, all the hospitals have emergency response plans. So this is not that different to, for example, a hurricane. Of course, there's clearly going to be a demand on health services, but we have emergency systems and we know what to do in that particular instance. So there's not that much difference there.
I watched on Netflix Pandemic over the weekend, and they keep on talking, the big one will come. Is this the big one?
It's certainly a pandemic. I don't think, if we look back through the years, there have been other serious pandemics, obviously. I think this will be the pandemic that will define probably this decade. I'm hoping there won't be more of this magnitude, but it is fairly big. We still don't know what's going to happen. There are lots of ifs, and we don't know whether it's going to peter out. It looks like it's got there's no prospect for it to peter out. It's an exceedingly clever virus. The fact that it can transmit itself when people have only mild symptoms, that's a worry. Yes. The fact that it's likely to be in the children without us knowing about it,
and that is also the main problem against SARS and MERS, isn't it? Because in the end, it doesn't go straight to the lungs. It actually sits in the throat and can multiply and happily sit there. That's
most people with SARS and MERS got very sick.
Yeah.
But with this one,
you don't get sick.
There are some people who are probably relatively mild. In some ways, that's a saving grace, but in other ways, it's actually going to allow the infection to spread much easier, because it's already been discovered that just taking a history from somebody won't necessarily pick up everybody. So I think, yes, I think I would say it is a big one.
So in the end, the problem is not that we cannot deal with the virus. The problem is that we might be overwhelmed by the amount of sick people at the same time. And so what you are doing and what we all are trying to do is we do two things. We try to delay it, and by delay, getting hopefully closer to some more effective treatment than we have available at the moment, and to get the infection rate down so that we can actually deal with the amount of patients that come.
Absolutely. That is the approach that every country is trying to bring about, some more successfully than others. And that is what we hope to do. So we really want to try to instill upon the public the need that if they think they have traveled and they may have symptoms, to isolate themselves before they start asking questions. Do that first of all and quickly, and their close contacts. Call public health or call their GP or their local doctor in order to seek further advice, but that isolation is critical. And it should not be seen as a punitive step, because it's actually there to protect the whole of the community. Yes. And everybody's going to be grateful that you've taken that step. I think at the moment, public opinion has moved and they now understand it is the right thing to do. Yeah, I'm proud of Cayman about the fact that very high level discussions appear to have been activated before they've happened in other countries.
Yeah, we're really good at that.
And I think it's due credit to the fact that the systems are working here, the systems of communication are working.
So is there a difference for residents and tourists who come in, how we treat them?
Not in terms of a public health approach, no. Mm-hmm. The only slight issue is if you're a visitor, it is possible that wherever you're living they realize that whoever is your host may be uncomfortable with you being unwell, which is why we have endeavored to source what we call quarantine facilities in order that the visitors, we can put them somewhere relatively comfortable.
Okay.
We had some emergency access to hurricane shelters for that purpose, which if you're a visitor, it's not ideal.
It's not where you come to the Cayman Islands.
But we're very close to having something which will be more comfortable for them.
Yeah. Now, without wanting to start a panic or anything, what can go wrong? Yeah. So for me, my understanding is what can go wrong is there are too many patients sick. That is the problem we need to work on. If too many patients get sick, our medical staff might get infected as well. And I read somewhere like when 20 to 30% of the medical staff get sick, your health industry just implodes. So I think this is step 3, 4, and 5 that we need to look at. And so what's your advice? I mean, I think the advice out there to all the public is obvious, and everybody has that with the sneezing and hand washing. But what's your advice to doctors? Yeah. How do we protect us? How do we protect our nurses? How do we protect our front office staff that have the first contact with the patient?
Yeah. So you put a whole load of stuff, you've just thrown a whole load of stuff at me, and I'll try and endeavor to take it apart a little bit. That is, you raised the very reason why we wish to try and slow it, and it can't be said enough that the more we can slow it, the more we can encourage the healthcare professionals to give the right advice in order that we can mitigate an outbreak. That is the right thing to do. you also can't plan for every eventuality. There's no amount of committees in this world that will be able to plan for every eventuality which will happen in an emergency situation. Right. So we endeavor to do our best. There are parts of our plan which are very advanced. There are parts of the plan which are less advanced. We're trying to get all that
ducks in a row
to a good state of readiness. But you're absolutely right. And within that planning is the issue of what happens if we need to have additional beds beyond the capacity of our current hospital facilities. And by hospital facilities, I mean all of the facilities across the islands.
Of course.
And so we have to think about that, because it could be that there are groups of patients who can be adequately managed if they're given some care in a more of a step-down facility, where they can have fluids, perhaps some oxygen, and certainly somebody to check that they're okay. But it wouldn't be at the level of a hospital. So those are the sorts of things that we need to think about, just as you would in a hurricane. You know, where are you going to house your people? How are you going to feed them? It's a similar sort of scenario, but we're trying to work through all of those scenarios. I would give a message to certainly the HSA is relatively well on board. Of course, they're a big provider. They come to many of these meetings. That to all of the healthcare community, we've all managed patients with infectious diseases which are potentially lethal. Yeah. We've had them sitting across our desks. We have treated them just like any other patient, and we've got on with our jobs. And I don't think this is any different. If you look at some of the other things that we meet, this is not the worst thing that you've ever met across the table from someone. So I really hope that we will pull together, and I have a feeling that we will. Any amount of support, if people reach out, certainly to the Ministry of Health or to Public Health, or to any leaders like you, if they need support to help them to get to that place, I'm sure we will all endeavour to do our best to get all practitioners to the level where they feel, yep, I can cope with this, and I'm going to be able to help. The programme from Public Health England is quite extensive across the UK overseas territories, and one of their current areas of interest is in expanding the laboratory capacity across the UCOTS. They haven't looked at Cayman because we already have a JCI accredited laboratory at the HSA. Having said that, the introduction of real-time PCR techniques is quite a substantial leap forward. So you will have seen in the press that there's been a bit of chatter about how soon we'll be able to get the HSA up and running. They actually have a PCR expert already who does do PCR at the HSA, but the machine has been located in the forensics laboratory and has not been dedicated to doing public health type work in the accredited laboratory. So there's a bit of a step and a crossover but that is the machine that exists, and the expertise, the technical expertise to run the PCR is already here at the HSA. There's also actually a PCR machine, I think, at the MRCU, the Mosquito Research and Control Unit. So there are two on island. With any test that is on a potentially lethal pathogen, you need to follow the advice of experts in laboratories. Yeah. So as everyone else, was guided by that process. Anybody that has a lab knows that they're stringent, and you're sort of got a lot of expertise around the sort of more technical aspects of medicine. We all know that we have to put in all these safety controls. So that would be my only concern, that they would need to, all of that would need to be put into place. The other issue is, hopefully the vaccine will come 3 or 4 months' time. There is a question about whether we've ever needed a PCR machine, and actually in the past, CARPHA, the Caribbean Public Health Laboratory, has been saying we're doing too few tests for things like dengue and flu. Flu, you've got the bedside test. We've got too few tests to keep the skills up for the laboratory. So although this may be a high volume issue, if this dies down, what work is there going to be? So that's an issue to think about.
But in the moment we send the swabs back to Trinidad, and then we have like a 5 to 7 days before we get that back as a turnaround. So if we would have the capability to actually get a better feel for where we are.
So the HSA are saying that should be certainly within 2 weeks, that ability at there. I think we may well have enough volume for in the short term, but
Yes.
the longer term is really a business decision about whether the capital outlay and also skilling your staff and keeping their skills up continually is something you feel it would work.
Well, yeah, obviously that's going to go to our business people and they can make that thing. But one thing is the business side, and the other thing is that I really feel that we are called to arms here, and if it means we buy a $20,000 PCR machine, then that cannot be the reason we don't do everything, pulling out all the stops.
The HSA will be validating their process. So I think, CARFA is the only reference laboratory in the Caribbean. So we will continue to send all our samples for verification to CARFA, and perhaps 1 in 10 of the negative samples and so on.
Okay.
Thanks very much for
Thanks for
inviting us
coming.
to talk. Okay.
Thank you for coming.
Oh, we shouldn't be doing that though. You caught me again.
I want to point out that we actually had this episode filmed 5 days ago. And the news and the facts have overrun us. And now we're looking at a situation where the Cayman Islands have their first COVID patient. And it has hit at a place where the COVID virus is most dangerous at, because it hit at Health City, which takes away, theoretically, for the time being at least, hospital beds that are possibly needed if more corona patients come.
That kind of step, granted it's stringent, but it's not always necessary, okay? Case in point, as you know, many of our patients with coronavirus oftentimes are asymptomatic to very mild cases of symptoms, approximately 80%. And you're talking about patients who present with a dry cough, fever, and shortness of breath. In the case of this particular patient who was transferred from one of our cruise ships, right? And then for something that I understood to be cardiac related, obviously, I think the steps in terms of prevention of the coronavirus weren't taken by those perhaps who were transferred that patient, or even the responders at the hospital. So I understand also that right after the cardiac event was addressed, the patient came down with respiratory symptoms. So that exposed more than one personnel of that hospital. So I do understand why that step might have been necessary. I hope it's not I don't foresee it to be something that will last, for another week or two, of course, because we definitely need that kind of service from Health City.
Yeah, I think the main challenge that we are facing, and that everybody is facing, is the moment that the genie is out of the bottle. It's very hard to stop it. And we are in the moment well set up on this island. We talked to Dr. Lee. We know what's all happening in the background. You and I are part of the WhatsApp groups of the government and our Doctors Hospital Health Services Authority, Georgetown Hospital group, that we try to work together as much as possible. I think we're giving them 10 of our beds so they can actually fit out some more rooms. So we are all getting ready for the storm that is about to come. Yeah, and when we watch the news and you see what's happening in Italy, and you see like the dominoes fall, and there's no way to assume that we are going to get spared, especially now knowing that the first case has been on the island.
Because even as you allude to Italy, I don't think probably the beginning of February we'll anticipate the extent to which Italy would have been impacted. And at present there might be 600 or 700 fatalities.
They actually started to stop looking after the old population.
Right.
They triage in the north of Italy, which is the rich portion.
Right.
They start to triage the patients by age. And if you're old,
Yes.
you'd get no medical care anymore.
And you can understand why is that, because
Yeah, of course, no. Of course.
As many of your viewers know, coronavirus is more impacting of our elderly population, those who have chronic illnesses, those who have are immunocompromised for whatever reason, whether it be something communicable or something related to cancers. But the point is, if they are overwhelmed in terms of resources, in terms of the medical personnel, then they have to make that kind of stringent decision. It's unfortunate, but let's hope that Cayman Islands is not overwhelmed in that regard, because we don't want to reach that state.
I think we need to point out that the Cayman Islands are in a unique place right now in this whole development. Number one is the WHO has called it a pandemic, but it's one of the first pandemics that we actually have a way to mitigate. We never, the world never had a pandemic we could somehow control, but the Chinese and the South Koreans have shown us how it's being done.
Yes.
And it's painful, it's aggressive, but it works. And that, I think, should give us a lot of hope.
Yes.
The other thing is that we need patient beds. And the Cayman Islands has more patient beds than the United States, and the United States has 3 times more patient beds than Europe. So we are already set up in a situation that we can actually, we have more reserves than most of the rest of the first world, which in itself is spectacular. As part of the senior leadership team of Doctors Hospital, how do we prepare?
We try our best to prepare by going to the source of preparation and readiness, and that is the Ministry of Health and the Public Health Department, right? Having furnished with a particular model in our awareness and our preparation, then we'll work with those key players. As it relates to supplies, of course, you know, the world is inundated with concerns. And sometimes if you're talking about even basic mask, people are buying things and there's
toilet paper.
You know, so even the necessities that hospitals shouldn't have an issue getting, we already knew that our reserves are very low, all right? So we have to partner with HSA in terms of getting the necessary stock available, right? One of the key ingredients in preparation is education. And we've instilled, or we've made attempts to instill in our public the confidence in our health providers, but also the confidence in themselves in making the necessary changes, the certain precautions that they themselves protect themselves and their loved ones. So education is crucial to this.
Absolutely.
Right? No institution, no hospital would want to treat all coronavirus cases. And as you know about isolation and quarantine, many of our patients, as I said before, probably 80% of those patients would not likely be at the hospital for an extended period of time and have to be recommended.
Because in the end, it is flu-like symptoms.
Exactly. So it is the patients who, unfortunately, who fit the demographics or are elderly patients for some reason, who might need extra attention. Those who are in that phase where they develop very serious respiratory issues and other problems, right? So it is those patients that we're concerned about, okay? But every patient is a threat, you know, do you understand? So I don't want us to be so focused on when you have coronavirus, it is catastrophic, okay? Because unfortunately, there might be patients among us who not necessarily came in, but who are asymptomatic. It is those patients who we know readily have symptoms which are very concerning, and we have to address it as a hospital. And that's when our resources become overwhelmed. And it's quite crucial that we look into it and we collectively as hospitals, Health City, HSC and Doctors Hospital partner together, because we're trying to deal with a pandemic.
Absolutely.
And the state of readiness, we can't really predict how ready we are until the volume of patients come in. So I don't want our resources to be too overwhelmed.
Yeah. One thing that we must not forget is the service to the community that we always do, and that will still be necessary independent of the coronavirus threat, which is an extra.
Right.
Yeah. So, do we have measures in place to divert the patients that come in and might be infected? And are we going to look after flu patients? Is that something that we keep on doing?
Something very interesting you said, because patients with corona, patients with flu, oftentimes are patients, and you initially sometimes can't make that distinction. Okay. So as I mentioned about education, we've of course informed the public when they're coming to the hospital with any flu-like symptoms, they prepare themselves with a mask. The second thing is we, as our customer service in terms of our front office staff, we're quite vigilant to protecting our patients and our staff from any risk of the coronavirus. So there are basic precautionary measures we do in terms of hygiene, which goes across our infection control measures as a hospital. Patients who present with flu-like symptoms, of course, we furnish them with a mask. We divert them to the necessary clinician who identifies them as high-risk individuals.
What makes the coronavirus so different from influenza and from MERS and SARS?
One of the things is the coronavirus. It's very similar to SARS. It's actually, the SARS is an example of a coronavirus.
Yeah.
Right, and MERS as well. All right. So those are what we call zoonotic viruses. They originate from animals and can transfer to humans. The coronavirus has a propensity. It's very contagious compared to the influenza, although not as fatal compared to the MERS and the SARS. The average period in which a patient manifests symptoms is about 4 days, 4 to 5 days. Okay.
Yeah. So those
patient
4 to 5 days you run around
right.
and you infect everyone and you don't know.
Exactly. Right. And persons can develop symptoms long after that. Okay. It may take 10 days for some, depending on the demographics. But these information are changes each time as we become aware of all these.
So where do you go to get your up-to-date information? Because no matter where you go, everything is like updated usually 2 days ago.
The reference that I find to be consistent, the CDC, the WHO, the Pan American Health Organization. So in terms of policies, protocols, signs and symptoms, those references are a useful tool, and it's consistent regardless.
So I think one of the most important features of a pandemic, no matter which one it is, to understand is that the flattening of the curve, as it's called, means we keep the infection rate under control, that the healthcare system can deal with the patients.
I'm reassured that Doctors Hospital, HSA, and the Ministry of Health will be trying or endeavor best to ensure that we protect the masses. It's unfortunate we had a case yesterday, and inevitably we may have several more cases in the next few days and weeks. We will do whatever it takes to protect our patients. At Doctors Hospital, it's important for us to remind our patients that we have an unwavering commitment to their change in health. Just remind our patients, remind the population that don't panic. You know, I know there's an obvious apprehension that comes with our first case, but do what you think is best to ensure that you protect your loved ones.
And
report to your physician,
the elderly.
Especially the elderly.
Yeah.
We just have to be more mindful now of those who can't protect themselves, who are more inclined to serious infection and complications thereof. That includes the elderly as well. Yeah. So we're committed at Doctors Hospital, and hopefully it doesn't get to a state where we're overwhelmed financially our medical services are not overwhelmed. And we're not exposed to something catastrophic at the very nature, anywhere close to what Italy or some of these other countries are experiencing right now.
Thank you.
Thank you for the invitation, Yaron. I
Thank you.
appreciate it. Always a pleasure talking to you.
What I invited you for today is your input of the general overall, I don't want to call it recession risk, although that is probably what it is, but the disruption that the virus has done to the world economy. And in my personal view, that is going to be much more painful than the virus itself.
Because to fight the virus, you have to take economic pain, which is what China did.
Yes.
So China's economic growth slowed to, we don't even know from the official numbers, but the economic data came out of China was the worst economic data I've ever seen in any country in history. That's the size of the pain. Up to 700 people were locked down. So the size of the economic pain for people who get it too late is huge, but they did what it took. South Korea was well prepared, Singapore was well prepared, Japan was reasonably well prepared. Italy was not well prepared, it was too late. So that means you have to do even more extraordinary measures to get it under control faster. So what does that mean? It means two things, and two things here hit the Cayman Islands, which is what I think is the important thing for people to understand. One is the financial markets. The financial markets have been at all-time record highs, all-time overvaluations, and there is almost nowhere to hide within that when something goes wrong, when something ignites the gasoline. And this virus is what's known as a black swan event, something that most people could not predict, and the market doesn't know how to price. We don't know how bad this could be. This could be bad, awful, or catastrophic in terms of economic terms. So the financial markets are struggling. Now, this island is built on a financial market economy and a tourist economy. That financial market economy, there is definitely going to be ramifications. There will be a slowdown in the financial services world. And even in the best case scenario, with the virus coming under control in the Northern Hemisphere summertime, maybe, we don't know, but that would be the lucky thing. Because a vaccine will take time to roll out. So the lucky thing will be a slowdown in the virus over the Northern Hemisphere summer. Let's ignore what happens in the Southern Hemisphere winter, because it could breed there. We've got probably 4 or 5 months of pain and slowdown in the financial sector to come. If it comes back, then it's a much bigger, broader problem, because it has a risk of taking down, let's say, the US pension system and a whole bunch of other things.
But, and you know I'm always the optimist,
Yeah.
I think we are in a complete different situation now. We are, depending on who you talk to, if you speak to Dr. Lee, who I just talked to, he says, like, hopefully in 4 months, but everybody agrees on latest in a year, we'll have a vaccination.
Yeah.
And that's going to be, and even before we have a vaccination, because there's so much money flooding into this problem that it's just a matter of time until we find a proper therapy. Yeah. And once you have that, you interrupt that
Exactly.
unfolding of disaster.
But the point being is we've still got a few months here where things are going to get really slow from the financial market side. So that's the legal firms, the accounting firms, the trust companies, and all of those people are going, I mean, none of their clients can fly around the world. Business comes to a halt for a while. If you run a shop here, or you have a business that relies on tourism, it's going to get tough times. And again, people here are prepared for that because they're used to hurricanes. They're used to business being shut down for an extended period of time, right? So nobody else is used to that. I mean, Italy's never had that apart from wartime. But the Cayman Islands understands it because it's part of its history. And that's, as you kind of suggest, it makes the people here unique because they understand that it's temporary. And I think it's great for brand Cayman overall to show what we can do, that we can take a bit of pain, that we acknowledge that we have to do it for the greater good. And as an island nation, we can all come together and get through it and rebuild as fast as possible from a position of strength. I think that's the magic of this island.
When we just look at our people, the Cayman Islands, what would you tell them? What should they do now?
Make sure you've just got a bit of cash, just because work may be slow for you. You know, rent becomes a little bit more difficult to pay. It becomes just a little more difficult for everybody. And we're hoping, very much hoping, that this is a short period, so leading into the summer, So if we plan for that and then make sure you've just got the resources you need to get through a situation like that. And again, it's very typical of this island to have that because they're used to it.
Yes.
And I think that's really important. And those of you who may find that you're self-employed and you may not get enough work over that period, I mean, that's going to be difficult. So just make sure that if you can, you've just delay a few purchases that you were going to have, just have a bit of extra cash, just so you know that everything is fine. The good thing is, if we're all at home, we're not going to spend a lot of money, so it shouldn't be too expensive. But it's your fixed costs, it's your rent and your electricity. So make sure you've got some of those covered. So you've just got breathing space. Say, look, fine, I'll do my thing, I'll self-isolate, we'll do what we need to do. Should the medical profession and the government tell us that's what we need to do? Maybe we don't.
Yeah.
But in that situation, just make sure you're okay, and then we'll be fine. Because most people here aren't heavily exposed to the vagaries of the stock market. They are exposed to the vagaries of the property market, and that too will slow. It's very difficult to construct things in this environment. So I think construction will slow down and sales will certainly slow. So I know there's some leverage from people involved in that industry, and I think people just need to be cautious and maybe even go and speak to the bank to say, this is the situation coming, how should we think about this? To make sure everyone's got a bit of breathing space. And if everyone's got some breathing space, they cut each other some slack, it's fine.
Yeah. But let's allow for a moment to press the panic button.
I understand that there is a risk that this could be a much larger economic event than any of us are prepared for. And people need to keep that in mind. And again, I'm not trying to sound alarmist, but we need to understand that this should the virus come back, for example, should it spread in the southern hemisphere over their winter, then it's almost impossible to get rid of. And the economic knock-on effects, particularly in America, Europe took a lot of its pain after 2008. So the stock market never really went up again. And they've had to intervene in the bond markets, and they've had to support the banking system, stuff like that. Europe slowing down is bad. China falling off a cliff is really bad. But the United States, if they find that this virus has spread further than they think and they have to pull up the handbrake and take extreme measures, the world falls off a cliff. And the issue is here, particularly in America, there's a couple of big things. There's the massive amount of 76 million baby boomers. The people born after 1945 to 1964 are all retiring. The average is 66 years old. The retirement age of America on average is 66. Okay. So they're all retiring, and they all don't have enough money in their pension plans because bond yields have been too low versus the forecast, and they're living longer. So they don't have enough money. Yeah. So the issue is they took a lot of risk. They have too many risky shares in their portfolios and too many risky corporate bonds in their portfolios. In a situation where a recession comes, the main buyer of shares in America have been the corporations themselves, issuing debt and buying back their shares. They're about the only buyer in America. The big flow of funds data shows this. In a recession, they don't have cash, so they stop buying their shares. So that means there's no buyer of US equities because all of the retirees want to sell them. On the other side, we have the state pension plans who are underfunded. And those states like Illinois and New Jersey, etc., raise taxes and put the extra taxes into the pension system, which is a good thing to do, to try and prop up the pension system. And that money has been buying the bonds that these companies have been issuing to buy their shares. And that was all a nice little loop. But the problem is we've already talked about how the corporations stop buying their own shares, but on the other side, tax receipts are driven by the economic cycle. So when the economic cycle goes negative, people pay less taxes because less people are in work or they're earning less money. And in which case, the buyers of the debt go away. And if there's a bubble in America, it's the massive debt bubble and the massive stock market bubble, and both at the same time can stop like that. And that is the really difficult situation. And it's not so much a banking crisis, sure, it's going to hurt some banks, etc. It's really a pension crisis. And that's something we haven't had our head around because that's a human crisis. Banking crisis was something one step removed. It was those fat cats on Wall Street. Yes. And they didn't pay the price for it. This is very different. This is your retirement savings. And that's why I'm particularly concerned, because we hope and expect that we'll be okay and that the economy will come back up and it'll be like a hurricane and not a bad one, and we get used to it. But if it flattens the island like Ivan did, it takes a year. Yeah. And within that year, these retirees are going to have a real pain. Misery. And it could have a knock-on effect for another 10 or 20 years because their retirement savings were less than they thought. So they end up spending less in their retirement years because they've lost a lot of money in the stock market, the bond market. Mm. So that could dampen growth. So that has a knock-on effect here because marginal spending in the US goes on things like the cruise ships, which is one of the arguments why many people have had about the cruise ships, that maybe the tourism could be fleeting in moments like this, and I think it will be. We will see with the hotels and the higher end tourism, with the overnight stays, of course it'll be hit. Will it be hit for longer? Generally not, because it's a different type of tourist. So I think there is a robustness built into this economy because we have both sides, but it is going to hit. And I think just the American marginal spending that comes on island will diminish somewhat. Yeah. So the boom time from tourism will probably slow down for a significant period.
I have to go into one thing that is very local and very local political, and that is the cruise ship port project.
Yeah.
Now, obviously, there's a lot of legal thing going on there, and it seems that the public has successfully decided that they don't want to have the cruise ship port. Independent on that legal portion of it, do you think the cruise lines are going to get hammered now? I mean, who wants to go on a cruise when you might come back with the coronavirus? Mm-hmm. So do you think they would actually still have an interest in doing that? Like from the other side? I know that the local population is against it to start with, but
the cruise companies are so on the back foot because they've gone from absolute boom to total collapse overnight. That doesn't normally happen, right? Normally you go into recession, it happens slowly. Yeah. But they have gone, literally has stopped overnight. So their ability to want to negotiate anything right now is zero. So I know they also flex their muscles because they're big, powerful corporations, and they want to get the best advantages for their own company and their own tourists, and that's fine. But I don't think they're in any hurry to do anything right now. Personally, I don't think it's the best industry to have here. I think better quality spending is better for this island, and
the overnight tourists.
Yeah, and then we can rebuild Georgetown into something more amazing. And I think that is a much better strategy, much less short term. And I think we're going to learn how short term this day tourism is, how little it really gives us, because it's just going to stop and they don't care. So they don't want to invest suddenly. Yeah. So it shows you how little they really care. Unlike many of the hotel chains and all the others who are coming here, they take time to develop what they're doing and develop a product. We're not a product for the cruise ships. We're just a stop. Yeah. I think there will be positive benefits that come out of this that I think we can all learn from.
Thank you.